Hey guys, I hope you're doing well. I was asked to talk more about urinary tract infections and some of the risk factors for urinary tract infections. But before I do that, I want to talk a little bit about our anatomy. So, behind the abdominal cavity are two organs called the kidneys. These are the organs that produce urine. There's one on the right and one on the left. Extending downwards from the kidneys are two tubes that connect down to the bladder. And then extending down from the bladder is another tube called the urethra. So, a urinary tract infection can involve an infection of the bladder, and it can even extend upwards towards the kidneys. So, first of all, one of the major risk factors for having a urinary tract infection is having an abnormality in the angle of the tube that carries urine out from the bladder outwards. If it's not at the right angle, bacteria can creep up from the outside into the bladder and cause an infection. An interesting fact is that urine is actually sterile. There's really not any bacteria in the urine. If there is, that is a time when you're more likely to get an infection, but not always. If you want to hear a little bit more about that, look at my video on asymptomatic UTIs. So going back to risk factors for a urinary tract infection, another risk factor is instrumentation or having a Foley catheter placed because, of course, bacteria from the outside are more likely to go inside. For women, another risk factor is having a pelvic exam within the next 7 weeks or so after the pelvic exam. Women are more likely to have a UTI, likely because the angle of the tube carrying urine from the outside has been changed or disrupted temporarily. Another risk factor for having a UTI in women is intercourse. For men, this is not a risk factor necessarily because the tube carrying urine from the bladder to the outside is longer for men. Another risk factor for having a urinary tract infection is pregnancy because, again, the anatomy or the angle of the tube has changed, but this is not for all pregnant women. Also, being immunosuppressed, meaning your immune system is down and the bacteria in your body have changed, is another risk factor for having a urinary tract infection, but not for all people. So, going to the next question, people have asked me or have commented or asked if, say, wearing tight clothing or, not changing your bathing suit soon enough are risk factors for urinary tract infections. Not necessarily, not for all people. For some people, say if they have an anatomy that's abnormal, that might increase their risk of having a urinary tract infection. But for most people, no, not necessarily. Wearing tight clothes and or wearing a bathing suit for too long is going to increase the risk of having a urinary tract infection. Another common myth is that drinking cranberry juice can reduce your risk of developing a urinary tract infection and it can treat a urinary tract infection. This is not true, and the reason that I want to state this is that because if you do have a urinary tract infection and you try to treat it by drinking cranberry juice rather than getting antibiotics within the right time frame, the infection will actually get worse. It'll go from your bladder up to your kidneys, and it can even travel into your bloodstream and cause more illness. So if you do have a UTI, it's better to actually get antibiotics and get it treated right away and deal with it rather than having to deal with a more serious infection in the future. So I think that's probably enough about UTIs. I hope that was helpful and informative. If you like my content, please like it, share it with your friends, follow me on TikTok, Instagram, and YouTube. Bye-bye for now.